In this section, I'd like to address some of the most common questions that we receive here at Advanced Dental Implant Center when we're providing full mouth dental implant treatment. I would say the number one biggest question that everyone has on their mind is, how much does this treatment cost and how am I going to pay for it? Our financial coordinators, that is really their job. We want you to have this smile, and our financial coordinators specialize in evaluating every type of option to help you achieve the smile that you want. Another common question that we receive is, how are these teeth going to feel when they're in my mouth? Am I going to notice that they're there? Do they feel natural? Especially from patients that have had a denture, because dentures do not feel natural in the mouth. We have done this procedure on thousands and thousands of patients. And what all of our patients tell us is that at first it does feel a little bit different because you do have something in your mouth, but once it's there for a period of time, it starts to feel more natural and they're going about their daily activity, eating, smiling without having to think about the teeth in their mouth. Patients tell us they don't even really notice that they're there once all the healing is completed. A different question that many patients will have is, how painful is this procedure? This procedure tends to be a lot less painful than what people think. The nerves that cause the majority of the pain in the mouth are actually in the teeth. When we remove all of the teeth out of the mouth, what we have remaining is bone. And bone tends to produce a dull, achy pain as opposed to a high, intense pain that you have with teeth. Since all the teeth are gone when we're doing full mouth, same-day dental implant treatment, the discomfort that you have from the procedure is quite a bit different than what you have when teeth are in the mouth. It's very rare that patients are having to ask for any type of pain medication refills after the procedure, and most patients are back to their normal activity within a few days, and pain and discomfort typically isn't disrupting their lifestyle for any significant period of time after the surgery. A very common question that we receive here at Advanced Dental Implant Center is, my previous dentist has told me that I don't have enough bone for dental implants. We'll commonly hear this from patients that have been wearing dentures for a long time, and this is true at many dental offices. At Advanced Dental Implant Center, we do some very highly technical procedures such as zygomatic implants and pterygoid implants, where we are able to help patients that have very severe amounts of bone loss, and we use these specialized implants to give them teeth on the same day. Not very many people around the country can do these types of implants, but fortunately, our clinicians and surgeons at Advanced Dental Implant Center do these procedures on a regular basis. And not only do we do them, we actually wrote the book on this procedure. And we teach this technique to many dentists from all over the world. So even if you are missing bone and you've been told that you can't have dental implants, that's very often not the case with us at Advanced Dental Implant Center. Many of our patients that have full mouth dental implant treatment are still working, and one question that we receive is, am I going to miss a significant amount of time from work if I have this procedure done? Typically, we do want you to take a couple of days off, and many patients will have this procedure done, say, on a Thursday or a Friday, recover over the weekend, and go back to work on Monday. Typically, you may have a little bit of swelling and inflammation, and that tends to peak within the first 24 to 72 hours after the surgery.